there is continuing progress. We are looking forward at a very positive element, the new model of care and the move to CMHT to a new location. And I think that it points to a positive future. Saying that, you have to realize that this is 2 years in the future, and from now till then we have to make sure that all our patients are taken care of as well. So this is where we are.
While you remain positive about the future, are there any recurring issues in particular which stand out to you as not having been dealt with or not being given sufficient attention?
I think with every organization you find that as you go along, you see the movement going forward, but there are issues that will recur and they need also improving. We have a situation where perhaps we have a problem with recruitment. That's always a problem that's always reoccurring, no? And we find that at least in the long term is being solved by the new cohort of mental health resident nurses in the University of Gibraltar. But that will happen in 3 years' time. Till then, we have to rely on agency nurses in order to fill the gap. So that's important. The question of the SOAD, which is a second appointed doctor for mental health purposes. This is very important because it safeguards the patients and their rights. And this has not always been present in the mental health review tribunals. And it's something which is necessary as a safety net. Recently, there's been a doctor a psychiatrist that's been appointed, at least virtually, and that's been a great help. I have been told that might not necessarily be the case anymore, so I'm concerned that should be something that needs to be addressed. And it's something which is important. It has to be someone who is a psychiatrist and needs to be independent from the GHA and government. So it's not an easy post to fill, but it's an important one for the patients because it protects their rights.
One of the issues often raised in Gibraltar is difficulty in accessing the correct personnel, be it a counsellor, a psychiatrist and so on. Is this something that you have seen as an issue in Gibraltar?
Well, I think it's been in the past, and I think it will continue being an issue because I think people rightly want to get the best possible service. What I have seen is a great improvement in the waiting list, although that's not really much good for someone who wants to see someone very urgently, and they need to be told that got to wait a month or 2 or 6 weeks. The issue here is that it is being tackled. There is now greater data being collected so that there could be an informed decision as to the kind of professionals that are needed in order to give that service. One thing which the report found out was something which I found quite interesting, was the fact that on the psychological aspect, over 1/3 of appointments that were given were people who did not attend the appointments. Now, this is quite shocking, really, and I don't know why it's the case, whether people were not informed or perhaps you need reminding in a different way, but that is a shocking amount of time and that I think needs to be sorted out. I think they're looking into this from January. They're looking into why this is happening, because that will inform the kind of personnel that you need, because you just can't get another psychiatrist or another psychologist in based on inaccurate figures. So I think it's something that needs to be tackled, and if we do need an extra psychologist or an extra psychiatrist, then it needs to be based on fact, and we need to get them.